We're now going to begin the physical examination, and we usually begin the examination with the head. You'll notice that the examination proceeds in a very orderly fashion from the top to the bottom, and as we go through the evaluation of various parts of the body, we will first evaluate the patient by inspection, palpation, percussion, and then auscultation. We're going to first evaluate the cranial bones, the frontal, temporal, parietal, and occipital bones, evaluating whether or not there is any depression of any of these bones. We also want to evaluate hair. We want to evaluate the texture of the hair and whether or not the hair is firmly attached to the scalp. Our assessment will then continue with assessment of the lymph nodes, and there are a variety of lymph node chains in the head and neck. We will begin with evaluation of the occipital nodes, and the evaluation is done by a very gentle rolling motion of the fingers as they go over the head and neck. We then come to the posterior auricular nodes, down into the posterior triangle, up along the sternocleidomastoid for the superficial cervical nodes, down deep to the sternocleidomastoid for the deep cervical nodes, back up again to the anterior auricular nodes, and down along the jaw margin to the tonsillar nodes, the submaxillary nodes, the submental nodes, and then moving up back to the anterior auricular nodes. We're now going to continue with examination of the eyes. Mr. Johnson, we're going to start with assessment of your vision. And visual acuity is determined by either a wall-mounted Snellen chart or very commonly a pocket Snellen chart, as I have here. Mr. Johnson, would you take your right palm and place it over your right eye? And I'm going to hold this about 14 inches in front of Mr. Johnson's left eye. And could you read the smallest line possible?
Okay, 2, 4, 8, 3, 7, 6, 1.
Okay, you can bring the arm down, and if you put your palm of your left hand over your left eye, and would you now read the smallest line possible?
6, 9, 0, 2, 8, 3.
Okay, you can bring the arm down. It's important to test visual acuity either with a formal Snellen chart or anything that has any print on it. Very commonly what you might do is ask a person to read the smallest line possible on anything that you might have by your patient, and then use something else to test the vision in the other eye. What we're going to do now is assessment of the external eye structures. And Mr. Johnson, if you just look at my nose, and we will now bring down the lower lids, inspecting the tarsus, the lids, and the conjunctiva. We'll elevate the upper lids, looking at the lacrimal gland area in this area. And we're going to check also whether or not there is injection or dilatation of the blood vessels in the conjunctiva over the sclerae, noticing the size of the pupils and the shape of the pupils as well. We're now going to check visual fields by confrontation field testing. For this procedure, the patient is asked to remove his or her glasses, and the examiner must remove his or her glasses as well. For this procedure, you want to stand approximately 2 feet in front of the patient, and you'll ask the patient to close his or her right eye as you close your left eye. So Mr. Johnson, could you close your right eye for me? And I'd like you to look at my nose. And I'm going to close my left eye and look at your nose also. The hands are placed slightly closer to me and in the nasal and temporal fields of the patient's left eye. Mr. Johnson, tell me how many fingers you see now.
3.
Okay. And how many fingers do you see now?
4.
Okay. Try again. How many fingers do you see now?
3.
Okay. What we're doing is assessing the nasal and temporal fields in the lower fields and in the superior fields. Please close your left eye. I'm going to close my right eye. Look at my nose. I'm looking at your nose. And Mr. Johnson, how many fingers do you see now?
3.
Okay, and how many fingers do you see now?
3.
Good, you can open your eye. Please make sure that when you do this procedure that the hands are closer to you, allowing the person to have the advantage of a larger field, and also that the palms are facing you as you hold up your fingers. We're now going to determine eye alignment and the pupillary responses to light. So David, what I'd like you to do is look in the distance, and I'm going to shine this pen light straight ahead, and I'm going to see where the light falls on individual corneas. We're looking first at the right and the left, and you'll notice that the light falls right directly in the center of the pupil, indicating that the eyes are straight. We're now going to continue on by using our pen light to check pupillary responses to light. And David, just continue to look in the distance as I shine this light from the side and shining it first on the left eye, looking for the direct and then consensual pupillary reflex, and then from the other side, the direct on the right and the consensual pupillary reflex on the left. We're now going to continue to test extraocular muscle function by means of evaluation of the cardinal positions of gaze. Because the rotational action of the obliques and vertical recti muscles cannot be easily assessed, the eye must be moved into 6 diagnostic cardinal positions of gaze that best isolate the vertical actions of these muscles in order to test their innervations. The oblique muscles are tested in adduction, that's with the eyes turned medial toward the nose, to maximize their vertical action. In contrast, the vertical recti muscles are tested in abduction, that's with the eyes turned laterally. In these positions, the superior rectus muscle acts now as a pure elevator, and the inferior rectus acts as a pure depressor. We're now going to test extraocular muscles. In order to do that, the examiner stands about 2 feet in front of the patient and stabilizes the patient's jaw. The other hand is placed with one finger in front of your nose, and the patient is asked to follow your finger as you go through the 6 cardinal positions of gaze. David, I'd like you to follow my finger. Okay, don't move your head, and follow it out here. You bring it out to about 15 or 18 inches from midline, all the way up here, and now we're testing the inferior oblique of David's right eye, the superior rectus of his left eye. As I bring the finger down, I notice the position of his eyes, being careful not to poke the eyes. We're now testing the superior oblique of his right eye and the inferior rectus of his left eye. Bring him back to mid-position. We're going to now switch hands. David, just follow my finger as we go all the way to the right, testing the medial and lateral recti, coming all the way up here, now testing the superior rectus of the right eye and the inferior oblique of the left eye. As we come inferiorly, we'll elevate the lids again to test the inferior rectus of the right eye and the superior oblique of the left eye. We're coming back to mid-position. David, I'd like you to watch my finger very carefully as I bring it in close, and we're now testing convergence of the eye, and we will then conclude this assessment in this position.